evening. My name is Micaiah Foster, and today I will be talking about the effects on Crohn's disease. Imagine seeing your mom laying there dying, losing weight and not being able to respond to nothing. She was withering in pain on the bathroom floor. She had been vomiting for most of the day, even though she haven't ate anything. She had just had a baby boy named Christian. She would say her body felt like she had got hit by a truck going 80 in a 45. This is the story of my mom, Quintetta Simon. Shortly after birth of her last child, she was diagnosed with Crohn's disease. Crohn's disease is an intestinal disease that, according to the U.S. Department of Health and Human Services, 1 in 5 humans suffer from. My mom was living with Crohn's disease since she was 4 years old. She can remember the pain and horror she used to go through. When she was smaller, no one understood, and her mom did not think of how serious it was. She just thought it was nightmares. Today, I would like to tell you about Crohn's disease and to share what I learned by explaining first what Crohn's disease is, the cause and how is it treated, and finally I'm going to share how different my mom's lifestyle is since she has been diagnosed with Crohn's. Crohn's disease is a chronic inflammatory condition that occurs in the intestinal tract. The American Society of Crohn's Disease and rectal surgeons say that inflammatory may occur in any part of the digestive tract from mouth to anus. It most commonly affects the last part of the small intestine and or the large intestine. Flare-ups come and go and very unpredictable. A Crohn's patient could go months or years without having a flare-up. Crohn's disease can be confused with ulcerative colitis. Because both of these diseases have similar symptoms, ulcerative colitis only affects the lining of the large intestine, while Crohn's disease affects the inner thickness of the bowel wall. Ulcerative colitis can be cured through surgery, whereas Crohn's disease cannot. The common symptoms of Crohn's disease can be pain in the abdominal and diarrhea, bleeding for the rectum, weight loss, joint pain, skin problems, and fevers can occur. Children with this disease may also have growth problems. Other problems can include intestinal blockage and malnutrients. It's not very common that children get this disease. It affects mainly young adults from 15 to 40. The cause of Crohn's disease is unknown, but researchers believe it is the result of an abdominal reaction by the body immune system. National Digestive Disease Information Clearhouse says, in Crohn's disease, the immune system attacks bacteria, food, and other substances that actually is harmless or beneficial. During this process, white blood cells accumulate in the lining of the intestine, producing chronic inflammation. This leads to ulcers or sores and injury to the intestines. In other words, people with Crohn's disease, their immune system overreacts and attacks everywhere that cause inflammation to the intestine. Crohn's disease have a genetic component. People who are from Jewish heritage have a higher risk. People who smoke is also at a higher risk for Crohn's disease. Treatments of Crohn's disease varies from person to person and also have how severe their Crohn's disease is. Almost always, someone with Crohn's disease is going to need long-term medical care and regular doctor visits to monitor their condition. The different medications and treatments include surgeries, medications, and natural remedies. Some patients require surgery. Some patients require antibiotics, steroids, anti-inflammatory medication, immune system suppressors, and biological medications. According to cancer.gov, biological medications is a substance that is made from a living organism or is produced and is used in prevention, diagnosis, or treatments of cancer and other diseases. Special vitamins, supplements may be necessary. Some people have long term of remission. Predicting when a remission may occur or when symptoms will return is not possible. Their changing pattern of this disease make it difficult to be certain a treatment is helping or not. My mom, Quintetta Simon lifestyle has changed because of Crohn's disease. Since being diagnosed with Crohn's disease, she has avoid eating food and have hard time to digest food like raw vegetables, oily foods, spicy foods, and things with seeds. When she does eat these foods, it is extremely obvious because she would be in a lot of pain. Quintetta has to avoid stress at all times because the increased flare-ups will happen. She makes the effect to take time to herself as much as possible to unwind and relax. If she do not, it causes stress. Quintetta do not eat much. She usually have really small portions. Lastly, Quintetta is going to the doctor a lot. She is also having injections in her body every 2 months by IV. It is called Remicade. Remicade is a fully genetically engineered human antibody that reduces the inflammatory that causes Crohn's disease. Quintetta has to sit in a chair for 3 hours at Brookwood Center and get Remicade fluids processed into her body. Even though this medicine reduces her inflammation, it does not remove it completely. Since doing much research on what Crohn's disease is, the other treatments, and how to change our lifestyle to prevent flare-ups, the whole family has decided to come together and learn tips and learn how to have a better diet to keep the inflammatory straight. I'm happy to say that my mom haven't had any flare-ups in 5 months, and that even though she has not stopped her Remicade, it has started to reduce it to every month now. Crohn's disease is a very infected intestinal disease that has no cure. Thank you.